when we first started our podcast, we had to get like probably 3 or 4 different websites and services going at once to record it, to edit it, to host it, and then have it approved through iTunes. And now we use Anchor by Spotify, where it's just a one-stop shop where you can record, edit your podcast, and when you distribute it, it'll go to all the platforms. So it's just everything right in one place. And the best thing is it's totally free. So if you want to get started, if you're on the fence about starting a podcast, or if you have a podcast and you want to make it simpler, download the Anchor app or go to anchor.fm to get started.
Welcome to the Think Fitness Life podcast, where we bring the mind, body, and gym together so you can improve your health, increase performance, and live your best life. For more information, visit thinkfitnesslife.com. Here are your hosts, Matt Gluckman and Eric Menchie.
All right, welcome to the show. If this is your first time with us, we have a very exciting guest on our show, Dr. Kevin Stone, who is an orthopedic surgeon at the Stone Clinic in California, and he's the chairman of the Stone Research Foundation. He has trained at Harvard University in both internal medicine and orthopedic surgery, and at Stanford University in general surgery. He is a world-renowned expert in biological joint replacement. I mean, this man has been working in this field for over 40 years. His team has developed 2 techniques for regrowing meniscus. Regrowing. Yeah, blows my mind too. So this man is really at the brink of technology. He has most notably served the U.S. ski team, the U.S. Pro Ski Tour, the U.S. Olympic Festival, and the U.S. Olympic Training Center. His innovative work in the orthopedic arena has led to multiple awards, publications, and grants, and has resulted in approximately 50 issued U.S. patents. So, without further ado, let me introduce Dr. Kevin Stone. It's a really fun interview that we got to do with him. He's also releasing a book called Play Forever, releasing later this month in December of 2021. Just going over how a injury can be a opportunity to improve performance and longevity. So I hope you enjoy. Take care. And Dr. Kevin Stone, please tell us of Play Forever, and we can start with explaining the difference between, when I think 80 or octogenarians, I think of people thriving and striving and out, whether they're farming or they're skiing or they're biking or they're running. That's what I envision. But I think a lot of people see an 80-year-old with a cane unable to move.
Ouch. So here's how we look at it and why we're talking about Play Forever. So when I see an athlete with an injury, my job is to see if I can help that athlete see their injury as an opportunity, and to turn that opportunity into training and fitness and health to become what we say, and you'll hear me say this often, to become fitter, faster, and stronger than they've been in years. And so the goal when I see somebody with an injury is to figure out how to get their mind to shift into that ability to see themselves as an athlete in training and not a patient in rehab. And then to have them become an athlete for life. And so when I see a patient, it's an opportunity to form a relationship, to help fix whatever is wrong, to help figure out their exercise and fitness program, and then to convince them that we can provide information and training tips and the latest in stem cells and growth factors and other things that are coming along to help them play forever, which is the title of the book that we're just releasing December 14th. So my goal is to help them drop dead at 100 playing the sport they love. And so coming back to your analogy to the 80-year-old, I mean, I've got 80-year-olds who are still running tries and who are still cycling huge distances and whose goals are, as I said, to drop dead at 100 playing the sport they love.
Yeah.
So I think, but I have other 80-year-olds whose goal would be just to be able to walk through the mall and not have pain. And that's a perfectly acceptable goal and wonderful. So our job is to figure out what does it take to help that injured person or that athlete see themselves as an athlete and train like an athlete. So If it's just to walk in the mall, it's, what do you need to do to help your posture and your fitness and your balance so you don't take a fall and you can enjoy walking in the mall. And if it's to run a century, which I have a number of 70-year-olds that I've put meniscus cartilage back in their knees because they said, hey, doc, I'll let you replace it later, but I still need to. So it really depends on what's the person's outlook, what their goals are, what they're willing to commit to, and then my ability to see if I can convince them that there's a whole world out there to play in.
Yeah, I love it. And I think pertaining to our specific audience, it sounds like a lot of what you're doing is kind of course correcting in a way. If someone thinks that they are stuck in this injury or joint pain and they think, oh, well, I have to avoid this exercise or I have to avoid this movement, you help kind of course correct and let them understand that, an injury doesn't mean it's over. It's an opportunity, right?
That's right. So most of my patients are between 30 and 60 as well. And often they, like me, injured their meniscus cartilage playing sports in high school or college. A doc went meaning well, but they went and took out the meniscus and then they developed arthritis over time. That's probably the most common story that I hear. And what we're trying to do is help all those athletes, whether it's a meniscus injury, an ACL injury, a shoulder dislocation, have them realize that if that injury is repaired, if the tissue is replaced, rather than them being told, hey, just go play in your knee till you need a knee replacement, then if we can replace it or regrow it or regenerate it early, we can help those patients avoid the arthritis that they get later. Or if they already have the arthritis in their 30 to 60-year-old age range, how do we treat that arthritis? How do we replace their missing tissues? How do we lubricate their joints? How do we do the things it takes to stimulate a healthy environment so they can keep playing?
Yeah, I think that's the tough part, especially with a lot of my clients and athletes that I've seen, is the meniscus. And once they think that it's gone, they're done. And I think that's a big problem because I'm sure I've never done a meniscus issue. A lot of times they get it snipped and cut. What you're seeing now, are there different procedures and way around how to recover from these knee injuries?
Yeah, so focusing specifically on the meniscus. And so for many of your listeners, they know that that's the key fibrous shock absorber inside their knee, and that they have got a medial one and a lateral one, and that if you tear that meniscus, you really want your surgeon to repair it, not to take it out. But unfortunately, the history of orthopedics has mostly been taking out that meniscus. We've learned that even when you take out 30% of the meniscus, you dramatically increase the force concentration on the tibia. And so since you take 2 to 3 million steps per year at up to 5 times your body weight, depending on the height of that step, if you lose a percentage of that meniscus, you're increasing the force concentration inside that tibia, and that occurs 2 to 3 million times a year. And so what happens is you wear out that surface. So to answer your question, yes, we're trying to teach surgeons around the world that we and others have developed the techniques for regrowing that meniscus section, for repairing those meniscus, and for replacing those meniscus. And that should be the first 3 things to think about rather than resecting it. You can run forever and not wear out your cartilage as long as you don't have an injury. And so the force concentration in the joint at 2 to 5 times body weight is really about the forces that we see in joints with running and with walking, depending on the height of the walk and the gait. And so when we work with runners, working with them on technique, shortening their stride, soft surfaces, smooth gait, these things really matter quite a bit in terms of how they land. Midfoot landing really determines how much force goes through the knee joint. And so we can work with runners and keep them running forever if technique is good and if they haven't had an injury. Once they have an injury, the key is to replace that tissue rather than run on the damaged or missing tissue.
So let's circle back here and go back to injuries leading to performance. And I want to hear kind of your personal story of how your injuries have led you to perform better.
So like many of us, I tore my meniscus playing soccer in college. I remember that moment of reaching my leg out and knew I shouldn't. And that right there is an important point. So it's the mental errors that cause so many of the injuries that I see, that momentary lapse of judgment, that skiing too fast, that that thinking about your girlfriend when you should be thinking about the sport you're playing, or that, distracted by your cell phone. Just so many ways to have a mental error in the sport that you're playing. And so if we can avoid the mental errors, we'll avoid a lot of the injuries. But in my case, I reached my leg out at the wrong time, tore the meniscus. The surgeon went in and took out the meniscus cartilage, and I admired his moving around the training room, and I thought, gee, someday I'd love to be able to take care of athletes like that. What I didn't admire, of course, was the lack of scientific understanding at that time of how important the meniscus was. And so many years later, I was out with my mentor for a run. He looked at my bow legs and knew my history and said, if you could ever figure out how to replace the meniscus cartilage, you'd make a big contribution to orthopedics. And so we started off in that process in the late 1980s. Developed the first collagen scaffold for regrowing the meniscus, and then developed a series of techniques for replacing it with donor tissue, allograft tissue.
Wow.
And so we've optimized that over many years now. And so, one of the stories related to that you might be interested in is that 80% of people who are told that they need a knee replacement actually don't. They could have either a biologic replacement where we replace the meniscus or regrow the cartilage, or they could have a partial knee replacement where we resurface just one part of the knee using robotic control now to make it much more precise. And that returns patients back to sports with a much more natural knee than if we have to go on to do a full knee replacement. So that whole field has changed quite a bit, but the role of cartilage replacement, both the meniscus and the articular cartilage, is dramatically changing it.
Yeah, it's fascinating to hear more about these. These are the cutting edge therapies that you were talking about. I mean, one of them, it sounds like you and your team have developed yourself, the regrowing the meniscus.
We have.
That's fascinating.
A lot of times with my athletes, we get ACLs, but we get meniscus to come with it. Is it kind of the same concept for ACLs? Same kind of technology you're using to heal and kind of, I know we do whatever you want, tendon grafts, whatever they want to use. But are you looking at new ways to kind of heal these injuries?
Here we are. The ACL is a good example. So you always need to know the bias of your surgeon, right? So
of course,
I'm biased towards replacing tissues whenever possible, towards not creating a second injury. So I don't take the patient's own hamstring tendons or patellar tendons anymore, where you create a second injury to repair the first injury.
Oh, yeah.
So we've gotten very good with donor tissues, which we now load with growth factors to stimulate the body to augment and accelerate the healing. And so we replace ACLs and all the other tissues around the knee with donor tissues now whenever we possibly can.
Okay.
And then we add growth factors to try to accelerate the healing process. And then if it comes along with a meniscus tear, we always want to repair that meniscus whenever possible. And if it's too damaged to repair, we want to replace the meniscus at the same time we replace the ACL. So the old days of living with your unstable knee, which then led to arthritis, we don't think is the right approach today.
Yeah, absolutely. Learn from the past. So how many, you talk about the grafts, how many of these therapies have you guys developed? Has your team developed?
So we developed the first collagen meniscus template for regrowing the meniscus called the collagen meniscus implant. And then we developed some of the first techniques for replacing the meniscus, the 3-tunnel technique for replacing the meniscus cartilage in the knee. And then we've been optimizing the ligament replacement. We developed the first pig ligaments to be used in humans. That was approved in Europe, but temporarily is on hold until there's more funding for that program. Eventually that will come back. And now we're really focused on adding growth factors to recruit the body's stem cells. And the body has billions of stem cells, and we can recruit their daughters, their progeny, to become progenitor cells and migrate to the site of injury by adding growth factors to these tissues. And so that field is growing very rapidly right now. We've learned an awful lot about what injections work and which ones are probably not as effective. And I know many of your listeners are quite curious about these injections, and we have been too. So we have a number of studies going on trying to optimize which injections for which problem.
Yeah. And one of the things that stood out in your book was chapter 6, the anabolic therapies. I love the word anabolic and therapies. So kind of, and the other thing that stood out was the cortisone, you kind of have a good stance. Like, hey, cortisone's the older therapies as you get in the book, correct?
Yeah, that's right. So cortisone shuts down cell metabolism. It
Mm-hmm.
inhibits the activity of cells. And so much of what we want to do for an athlete is to augment their cellular behavior, augment their healing. So anabolics, as you used to think about them only in testosterone, we now think about anabolics in terms of how do we juice the cells of every tissue that we're trying to repair so that they heal faster or they recruit more potent stem cell derivatives to that site of healing, or how to accelerate blood flow into the tissue. And so each of these are anabolic therapies of stimulating rather than inhibiting. So if you think about an arthritic knee is more degradative. It has enzymes that break down cartilage and it's swollen and unhealthy. We want to shift that degradative environment to an anabolic environment, positive environment with growth factors in it. If you think about an injury that's been going on for a while and you've got kind of chronic swelling in the knee, that swelling has degradative enzymes in it. We want to shift that tissue over to more anabolic things. You might think of tennis elbow or the other tendonitis that people get. Again, another example where there's a degenerative environment sometimes and it goes on for a long period of time. And we want to shift that environment to a more positive anabolic environment.
So what growth factors specifically are you guys and your team looking at to increase and help with these post ACL, post meniscus surgeries? Because I think a lot of times people think growth factors and stem cells, and they think it's like, I want to say bad, but they get a little afraid because they don't understand what's actually going into this and what the body is doing.
So there's about 4 major groups of injection type therapies that we can just run through a little bit. So first, the most common is PRP, where we draw the blood from the patient, we spin it in a centrifuge to get the platelets out, and we induce those platelets to release the growth factors and cytokines, which is the name of factors in your body that can recruit your own body's repair cells and can modulate the healing environment. So PRP from your own blood is a potent tool for using as an anabolic therapy. Whenever we use PRP, we're almost always adding a lubricant to it called hyaluronic acid, the natural lubricant in the joint. And the combination of PRP plus HA or hyaluronic acid is our most common injection therapy today. Two other areas that you might hear quite a bit about. One is bone marrow aspirate, the other is fat aspirate. And those are ways of adding cells to the PRP, the stimulant. And then lastly, you'll hear a lot about birth tissues where amniotic fluid or tissues from the umbilical cord are used. So right now, the FDA has put a pause on the use of birth tissues until there are more studies done they consider them a drug rather than a device. And so those therapies are a little bit on hold. We've done quite a lot of studies of those therapies, prospective, double-blind, randomized control studies of these amniotic fluid and tissues, and determined what the effects are of those tissues on the joint. They're very potent therapies, and they will come back and be used quite commonly soon. Right now, the patient usually has a choice between fat, bone marrow, and PRP. And we currently believe that PRP has enough recruitment factors in it to bring your body's own stem cell derived repair cells to the site of injury. So it's more cost effective for most patients to use PRP plus HA than to bother to inject cells into a site of injury. We think the cells tend to die and go away quite quickly, where we can recruit the billions of stem cell derived cells that your body already has with PRP derivatives. So right now, that's the most common spot, but it's quickly evolving. We're doing quite a bit of research in this space, and we're quite excited about it.
Yeah, it's fascinating because this is all really hot topics that have been across the board in a lot of different media outlets for some years now. But so along with creating that, that anabolic environment, getting away from the degradative environment, it sounds like your practice also does some sort of physical therapy, basically post-surgery rehab that you guys are doing hands-on at your facility. Is that correct?
So this is probably music to your ears and the things that you sing every day to folks you work with. But, I don't believe any patient coming through with an orthopedic injury that needs either non-operative treatment or operative treatment can possibly do as well as they do when our fitness trainers and our physical therapists get a chance to work with them. And so every patient spends usually about 2 hours a day, the day immediately post-op, starting out their fitness program. And every patient sees our rehab team before surgery to try to avoid surgery and see if we can get them better without ever operating on them, which in many cases we can. And so the combination often of injections and therapy helps a lot of people avoid surgery altogether. In fact, it's so potent that I now have a huge number of patients with x-rays that look like they have terrible knees who come in once a year now for their lube job, as they call it. It's an injection of HA and PRP. And you look at their x-ray, it looks horrible. You look at the way they walk, it looks horrible. But they say, hey, doc, my knee doesn't hurt after that injection you gave me. It lasts 6 months to a year. I'm not letting you operate on me. I'll come back when it hurts. And so they come in, work with our rehab team, focus on fitness training. I do their lube job once or twice a year, and they're staying out of the operating room.
And
that's fascinating. I love
that's
that.
key, because a lot of times it's the opposite. People want to get surgery. They get the surgery. They don't really follow through with physical therapy or anything, and they have more pain. So what are you seeing in your practice of the people's mindset where they're not going through the surgery, but yet they're feeling better? And they're like, hey, this is great. I'm loving it. But your images say something different.
So they fall into two groups. The young group that has an injury that should be repaired, so that way they don't produce more damage to their joint. They should be repaired. I feel badly sometimes when I'm giving them a therapy that gets them through the season, but I know they might be injuring themselves further, but it's just the way their pro season is working out. They just can't afford to take the time to have it repaired at that time. And that's true for a lot of my professional athletes. Mid-season, just preseason, they're not going to undergo a surgical procedure if they don't have to. For my older patients,
is wasted on the young.
Yeah. For my older patients, though, who have been living with it for a long time, and sort of the horse is out of the barn in terms of the damage. If I can keep them out of the OR and they can keep their mindset positive by doing the sports they love with an injection, that's great.
Perfect. Yeah. So then one thing I wanted to talk about is just, how important it is to avoid that constant degradation of that environment. I think, you're talking about the post-op and the rehab team helping basically retrain the body and the brain to function the way it should without creating damage on that joint or ligament or tendon. So, I mean, do you have sort of a figure or an idea of the patients who follow your post-op and rehab team instructions and the people who don't, and how quickly they return because of more inflammation and pain?
Yeah, we try really to not operate on folks who don't buy into our program of using their injury as an opportunity.
Yeah,
and
absolutely.
If you can do that, you really markedly improve your outcome. When a patient goes into the operating room with a smile on their face, they're relaxed, they're confident, they do so much better. The surgical team does better. The nursing team does better. Anesthesia goes better. They come out of the procedure with much less discomfort and anxiety. The entire rehab team works better with them. Just the patient's ability to control their mindset and their environment is dramatic. And a smile goes a long way. And that's true in rehab programs. It's true in fitness programs as well. Your attitude determines how you do.
Yeah.
1,000%. And I think adherence tends to be like one of the big problems. And I think there are just the people who have the mindset of when I get a problem, I go to my surgeon. When I get joint pain, I'll just have my knees replaced. And they don't understand that, I guess, that there's ways that they are contributing to that problem. And there's ways to, kind of shift the direction to take it as an opportunity. Like, take your pain that you're noticing, your reoccurring pain in your joint, and take that as an opportunity to, you got to heal it to feel it, to then strengthen and improve so you don't have to come back for surgery or another surgery.
Yeah, that's our goal. Keep them out of our OR. It's even better.
So let's talk about mental fitness and grit as we're going down this direction here, because I think it is a big topic where, again, you get people who they do a lateral lunge to the left and they feel pain in their knee or their hip, so they just avoid doing lateral lunges to their left altogether. And And, let's talk about how it's not about necessarily avoiding it, but it's about trying to learn from it and work from the pain to a better place.
So in a sense, there's good pain and bad pain. So good pain, we think about as we counsel people to never watch TV or read a book when they're working out, because you lose 50% of the benefit. You need to be able to listen to your heart rate, you listen to your muscles, listen to your breathing. So you know when you're coming up against your fitness levels, and then to push a little farther and push through that, and to try to improve with every session. But you can't do that if you're distracted, and you can't do that if your mind is off watching TV or reading a book. The whole part of fitness training is really listening to where you are and helping get yourself to the next level. Now, that said, we also counsel people, though, that if it hurts in the joint or if the tissue is producing pain, then we need to figure out why. Pain in the joint, pain in the tissue is not usually helpful. And for our arthritic patients who come in with arthritic knees and say, hey, doc, can I just get fit first before I have surgery? It's very, very hard for people to build muscle if they're having joint. The pain inhibits the muscle development. So we need to listen and figure out which kind of pain are we talking about. The fitness pain, we want that. We want you to know what it feels like. We want you to get comfortable working through it and pushing those levels. The joint pain from injury, we want you to pay attention to.
Because that's the pain that's important. Because a lot of the athletes that I've seen, once they're in pain, all of a sudden they think they're broken. And you can see their attitude just start to drop because they think this is going to be something that's long term, which it could be, but treating it the right way, I think is the most important part. And it seems with, especially the PRP, that's looking like it's going a long way. Will you just see people besides knees at different joints and you're like, hey, we're going to go the PRP route and explain it to them. These people get the injections and all of a sudden they're regenerating tissue and they're feeling better around that joint?
So we don't have evidence that PRP regenerates tissue per se. And so one of the faults, I think, of the early stem cell promotion. The cells don't really regrow the tissue, but they do modulate the environment. They shut down inflammation. They're potent antifibrotics. They're potent antimicrobials. So they're potent recruitment factors of the body's own repair cells. So they do a lot of very positive things in terms of shifting to an anabolic environment and diminishing the degradative environment of those enzymes, but they don't regrow tissue. So for the patient who's missing that meniscus tissue, the patient with a torn meniscus, they won't get healed by an injection, but their joints will feel better and probably be more protected.
Now, I don't know if there's any research on this. Will the tissues around, like tendons of the muscles, will that be affected by the PRP?
They are affected. So all the tissues that come in contact to these anabolics are affected. And we're learning how, clearly an ACL injured knee should have a different therapy than an arthritic knee or than a torn meniscus even. So the tissues are quite unique, and we're learning how to titrate, how to pinpoint which therapies each tissue should get.
Gotcha.
It's a great field. It's a lot of fun. And it's, try to inspiring people to, as I said, see their injury as an excuse, bring to them all the learning that we are getting from the science side of these things, and then also work with things you've known for years, how to look at their psyche, look at their enthusiasm, look at their fitness level and assess it and incorporate it and make it part of the recovery process, and not just recovery, but part of the fitness process. And we all know that fitness has, at least 10 components to it, as we've all learned. And that brings up, which exercises are important, which things to do. And we've all learned to focus on mobility before we focus on strength. And we've all learned to focus on, balance and coordination and accuracy and cardiovascular fitness, as well as strength and power. So coming back, you're going to ask about some of my favorite exercises. There's no question that if you're going to be efficient in the training room, a squat is probably your exercise. But squats done with good form, and really it helps so much for your listeners to get a great trainer, look at your fitness, look at your squat technique, optimize it. And then if you only have time for a few exercises, that's right at the top of my list for your most efficient single exercise.
So I guess my follow-up question to that would be, I've had people with injured meniscus, and they said, my doctor said I should not squat. what is your take on that kind of statement? I know it's kind
Yeah,
of a bold statement.
that technique matters, and
Mhm.
that depending on the, it certainly depends on the type of injury that they have. Most knees and can squat to 90 degrees without difficulty, and people with posterior meniscus tears can't squat past that because they overload the back of the meniscus there. People with a lot of anterior knee arthritis can't because they'll overload their patella. But within the range from 0 to 90, most patients can get by quite safely. And it's a good screening tool, because if they can't do a squat in that range, you need to figure out why. What's going on there? Is it just tissue tightness? Is it technique? Is it hip tightness, which so often it is? Is it lack of low back flexibility? Is it just fear? And fear
Right.
is a big part of it, because I think so many people have been ingrained with the concepts that, squats and weights are dangerous, and they are if the technique's not good,
Of
and yet
course.
they're potent tools. It's probably my most potent anabolic is a squat.
Mm. Well, and it's a
I
tough
love
thing
it.
because a lot of
Good answer.
times doctors will come out and give these rigid protocols. And I know it's an orthopedic minded, but it's great to kind of hear, surgeon doctors saying, hey, yes, we're going to do all this. We're going to repair it, but you still need to do all this stuff afterwards to get strong again, so you don't end up back on my table. And a lot of times people get so afraid of these movements because they think it's going to hurt them or cause more damage, and then they lose out on potential benefits of those movements.
Yeah, that's definitely true. So another thing I'd put in there too that you want to encourage the folks you work with to think about is think about creativity. Because even though there's lots of standard exercises that you can do, everybody's a little bit different. They've got different interests, they have different degrees of mobility in their different joints. But if you're creative about how you train and how you use the training room and how you use your sports, you'll find that there's always ways to do things that make you feel great and actually work to help your fitness program. We always encourage people to pick up a new sport or a new technique every 6 months, because it helps teach you to be an all-around athlete. And it helps your interest level and your innovation and your creativity and your fun. And really, we've learned very quickly that if the rehab isn't fun, it's just hard to have adherence, as you brought up earlier, the stickiness to the sport you're doing. And so fun matters quite a bit. Creativity matters a lot.
Yeah, and I think it's safe to say that you do more than just surgery, and it's really clear that your practice is promoting, like, the holistic approach in a way, and I think that's something that's missed out. I mean, I talked to a lot of clients who, you mentioned about having the bias and knowing that they're biased, and I've had plenty of people I've met at the gym, and they just said, oh, I just got my hip replaced, my knee replaced, and my surgeon says I'll be back in 10 years for another one, and it just seems just a totally different mindset to what I've now been introduced to by your book and your practice. So I really appreciate you coming on the show, and I just have a couple more questions
Sure.
for you, and just really more about you. And so you said the squat is your most recommended exercise, but is that your favorite exercise or activity?
It's my most. So there's a difference between playing and training for me. But so
All
for
right, I like it.
efficiency in the training room, squats, there's no question. And
All right.
for play time, though, I've just picked up e-foiling, which is a totally wild sport where we're getting on a small surfboard and a foil underneath it and a little propeller. I'm using it to train to learn how to foil, because then I'm going to do more wing foiling and windsurf foiling come spring.
Oh,
So
wow.
I'm on the
Cool.
water as much as I possibly can here in San Francisco, even when it's a little chilly. And
All
so
year round.
all
Yeah.
year round, and clearly on the bike and skiing as well whenever we can, and hiking this weekend. And so,
I love it.
we use the environment, and we try to use it in a way that makes us happy.
I love it. And I love the distinction between training and playing. I think it's important for people to hear that as well. So real quick, what's a favorite quote of yours? I ask this to everybody who comes on the show.
Well, in my professional life, my favorite quote that I wrote is that cancer may kill you, but arthritis ruins your life. And so
I like it.
our focus on not letting arthritis get people down,
I
and
love that.
really saying, hey, look, we can treat that. We can fix those issues. We can get you being athletic. Don't let these things that have held you back for so many years, whether you're 30 or you're 80, be the cause of staying home and sitting on the couch. And so that's where a lot of my
That's
research drive is. It's where my patient care drive is how do I bond with that patient that first time we meet and inspire them to become athletes for life.
I love it. And I love your quote. It really hits on a lot of different levels there. And then go ahead and tell our audience where they can find out more about you, your practice, and your book.
Yeah, so we're here in San Francisco at the Stone Clinic. It's called stoneclinic.com. The book is called Play Forever. It'll come out December 14th on Amazon. Our research you can find at stoneresearch.org. It's a public nonprofit research foundation. Come support it because it supports the research that we're doing to help keep you active. And we're happy to help people anytime in any way that we possibly can.
Great. Thank you so much, Dr. Stone. And thanks so much for giving us this opportunity to interview for our show. Really appreciate it.
My pleasure.
If you're ready to make steps towards improving your health or increasing your performance, book a free 30-minute call today by visiting thinkfitnesslife.com.